Hello, my name's Laura Lear and welcome to the Thoughtful Leadership Podcast from Ambitious. So the health tech space is a really exciting space to be in at the moment, and it's moving very fast. And some of this is due to clinicians who have identified gaps in the market, moving out of the NHS and looking to start up their own private health organisations. Now, my guest today is a former ENT surgeon, and he has gone on to set up and become CEO of an organisation called Tympa Health. And I'm really looking forward to digging into that in a little bit more detail now. So please welcome to the podcast, Dr. Krish Ramdoo.
Thank you for having me.
Thank you. It's great to have you here. Well, I think we'll start at the very beginning, because I think obviously former ENT surgeon, decided to kind of take the plunge, start your own business. It'd be great to understand sort of what some of those moments were that led you to do that.
Well, I think one of the things which was interesting for me, the problem we are now solving for at Tympa is a problem that I was living and breathing. I was an ENT surgeon, as you said, and I think the real notion was I was seeing all these patients that were waiting weeks on end to see me as a specialist, and I used to think, well, why are they waiting so long? Mm-hmm. And I remember one day I was looking at all these tools that I had on my desk, and I was thinking, okay, there's tools that we need to make into one system. The fact that actually the access wasn't very easy and it wasn't digital, and I thought, well, okay, somehow I've got to solve for this, because a lot of the patients that came to see me, I said, they don't need to see me. Could they have been assessed in the community? And that I kept seeing that similar type of patient. I was in the NHS for about 10 and a half, 11 years, but I kept seeing the same patients. And I think then I thought, I can do something about this. And there was a journey that I was on as, being a clinician and, becoming a consultant. But I thought, well, actually, how can I make more impact? And that kind of drove me to kind of what we've now done at Tympa.
And talk to me a bit about the transition then into being a kind of a founder and a CEO. How long did that take? Obviously, you come up with an idea. There's a whole process in terms of developing that product, proof of concept, going to market, investors. It'd be great to understand a bit about that. And because coming from the NHS, presumably you didn't have necessarily the business background. Yeah,
no, definitely. I mean, I sometimes I look back, I think, well, the idea maybe formulated over about 5 or 6 years. And as I said, that journey of seeing these different type of patients, and really what happened for me was I thought, well, I stepped out. I wanted to have some time to think about the idea more. So the only way that really I was busy operating, I thought the only real way that I was going to get time to do that was do another degree. So I stepped out and did a PhD alongside my surgical training. And it was at that point, I guess I was being seen as this kind of expert in the field of ear and hearing care. And I remember going to this AGM, this charity of group, and I did a talk, and in that audience was the CEO of Boots and Specsavers. And I was talking about the future of ear and hearing care and what a system should look like. And they came up to me afterwards and said, you know what, if you develop this, we'll be interested. And that was the first time I thought, okay, there's a commercial need for this. And people would, when you have ideas, you're like, well, sounds like a great idea on paper. Will someone actually buy it? Will people want to use it? That kind of gave me the confidence to think, well, actually, let's try and do something. And the journey took time. Like I think and I'll talk about kind of the funding journey, but as we raised money, I wasn't quite ready to leave the NHS. And I kind of pivoted from ENT surgery. I think I'd raised our first £1 million. And at that point, I was like, well, do I leave now? Yeah. Or actually, should I understand the journey a bit more? And what I did was and it goes back to kind of living the problem. I went from ENT specialist to then I went and did my GP training. So I understood the hospital environment and I said, well, I don't quite know this journey fully. Let me understand the GP, the primary care environment. So I did that for a while. And then we raised another, I think it was about 2.5 million after that. And at that point I was like, okay, the product has moved, like we've developed a kind of proof of concept. And I thought, well, actually now is the time to actually step aside. But it took me a long time. I think in between that I had my first child was born and my daughter came. And I always think when my daughter was born, which was about 5.5, 6 years ago, that's when I decided to step away.
It's quite a big thing, isn't it? I would imagine to go, right, that's it. I'm going to throw myself into this, walk away from a paid job, etc.
100%. And so I was almost de-risking it in my own head. But also sometimes you just got to take that plunge, and it's never easy either.
And it sounds like you've got a real mission or you see a sense of purpose when it comes to what you're trying to achieve. So it's not just a business, but actually there is a real need. It would be great to hear a bit more about Tympa Health and that purpose and what you're hoping to achieve.
Well, that is the North Star. I think the North Star, when I started thinking about it in more detail, I was like, well, huge problem in the UK, disjointed, challenging for patients to get to see a specialist. There's post-COVID, this move towards a bit more digital into the community. But when I was then looking at it, I said, that's not just a problem in the UK, it's a problem in the US, in Europe. And this notion of hearing loss and unaddressed hearing loss, when I looked at that a little bit more detail, huge stats. It was by 2030, hearing loss is going to overtake diabetes and cataracts in the top 10 disease burdens. And that's because of the aging population. We all have AirPods, listen to loud music. That's exacerbating that. But then you take it a step further and think, well, actually, if we identified it earlier, hearing loss in itself is the single biggest modifiable risk factor for prevention of dementia.
Yeah.
So people should be thinking loved ones, parents, get your hearing checked. And, it's linked to social isolation and depression. So when I saw that as a problem, I then said, well, that's the mission. And that was the North Star of saying, I don't want to just change the way ear and hearing care is delivered in the UK, the US, has to be across the world, and make it more accessible, and do that through a digital platform, a platform that can be used safely by allied health professionals. And that's what we've done at Tympa. And, for us, I think I'd hope anybody in the company knows that where we want to get to is to go and support people in low-income resource countries, deliver them a service which they never would have had access to. But we are only going to be able to do that if we have a strong base here in the UK, the US and other countries, so that almost a test in the UK is funding a test elsewhere.
Yeah. And so how far are you on that journey when it comes to kind of scaling globally?
So in the UK, I think we've done a really good job. I'm very proud, like now, having been an ENT surgeon, there was always going to be a cap on the number of patients that I would have had impact on. And now, today, as we're filming this today, I think it's 45,000 patients a month which go through a Tympa journey in the country. And, I would never have been able to see those patients, even if I was working every hour of the day.
Absolutely.
So the impact that we're making here is huge. And also, I think the way that we've changed the way people access care, 3 years ago, community locations like pharmacies weren't delivering this service.
Yeah.
What Tympa's been able to do here in the UK is develop one robust program so that allied health professionals can deliver the service, create new pathways so that actually it's a safe, clear referral pathway for patients to go to a community environment and get to the right patient at the right time.
Yeah.
And so I think in the UK we've done that in a good way. And like when you start where we are on that journey, I still feel probably in the UK we only scratched the surface.
Yeah.
We're in community pharmacy, audiology. We've just been commissioned by the NHS as well.
Amazing.
Because of the evidence base that we've put out there. We're looking at care homes. So huge plethora of sectors. And that's why we've only scratched the surface.
Yeah.
We've launched in the US. We've launched in Florida and really got some, we've got our first big commercial contract there. So I think we're also showing that we're making an impact there. We've launched in New Zealand. We had a partner who knew about the product and was like, Krish, I'm setting up a audiology practice over there. Tympa needs to be in it. And we've launched with them through a partnership, and we're looking at other European countries now. So on the kind of developed world, I think we are making moves and making an impact. But then in the answer to kind of how we got on the kind of developing world, the challenge I always think is that if we're going to do it, we need to do it in a way that's sustainable.
Yeah,
like you can't
absolutely.
just drop in and then drop out. So we have done some work where we've had some ENT surgeons go out to Nepal, Cambodia, and even in that short period of time, it's so good for them to upskill these nurses to look in the ear, understand what they're looking at. But what our digital platform does, which is where the future is going to be, is if they see something they're not sure about, they can press a button in the platform and get advice remotely.
Right,
and that's the world that I want
absolutely.
to kind of get to.
No, it's fascinating. And it must be so great for you, the NHS partnership, to be going back into the NHS,
Absolutely.
having come from the NHS as well.
I mean, we are by nature an NHS spin out, like a true bench to now into the clinical environment story. And even the NHS, the hospital trust I worked at, they have a small stake in the company as well. So it was always interesting, that journey to kind of get into the NHS was, we had to go to the private sector first, prove the case, prove that it was safe, get the evidence base, to then come back to the NHS and say, well, if they're doing it, why aren't we doing it in the NHS? And I think that's just taken time. And it's such a huge machine, the NHS. You've got to do some local pilots first to then say, okay, this could be a national rollout now.
And do you feel quite passionately about the NHS?
Yeah, I mean, the thing is, it one gave me my training, gave me the vision to kind of get Tympa out there. And I think it's just a challenging time at the moment. Like, everything is stretched, and I feel everyone's feeling the pressure. And so the only way that it's sustainable is, how do we, one, there's not enough specialists. You always hear on the news, not enough GPs, not enough specialists. There's a workforce that, if we can provide them with the appropriate skills and training, what can they do to support? And then, technology's there. Like, we need to move towards a digital way of working. And I think people are embracing that more as well.
Do you think it's really important, because obviously there's a real boom in the kind of the health tech space. Some of those businesses are set up by former clinicians and people who have that knowledge, and others aren't. Do you think it's really important that those businesses do have that clinical kind of expertise within at the start, so they really understand what the challenges are?
Well, I think that if I look at all the businesses that have been successful, it doesn't have to be the founder that is a clinician, but I think somebody who understands the journey. And I think there's two things that you probably need to be able to understand, I think, in a health tech company. Is one, a clinician who probably really understands the patient journey and the pathway for them to use the solution. And then, it is just the nature of the beast. It's someone who understands how to follow the money. Because even in the NHS system, someone is paying for that service. So if you don't know where that money can come from to save money elsewhere, that becomes quite challenging. So I think you need to be able to understand that. I think probably the benefit I had was, one, I knew the clinical journey, and two, because I did that bit at the beginning, maybe knowingly but a little bit unknowingly, I learned how the money flows in the hospital environment and in the primary care, the GP environment, to then link the two together. So I think it is really important, because otherwise you can probably build a solution that think, well, the patients will definitely want that. But if you don't get the two together, then no one's going to be able to pay for it, particularly in the public sector as well.
And how have you built, sort of going back to the early journey again, that business acumen up? You've obviously, you have people around, I'm sure, who guide as well and support, and, going through those rounds of investment. Can you talk through that journey a little bit, and some of the challenges as well?
Well, I think you've got to learn fast. I guess even before I even did medicine, it's funny enough, actually, I was talking to my son last night, actually. This is actually quite interesting. And he is going to go through his 11 plus soon. So he said to me, when I go to secondary school, will they tell me like what job I'll do? And I said, well, they do kind of try to help you, career advice. And I said, I need to go back and look at what they said about me. And I think there was a definite view towards healthcare, but also finance. And I was quite good at maths back in the day. But in terms of learning, definitely on the job. Two, I think, surround yourself with people who you can learn from as well. And I think I've done that, either that through investors or mentors, but also people in the business. And I think you have to constantly keep learning. Like, I feel like I know the clinical journey very well. But I think I'm always learning, and it's always evolving. The commercial and raising money side of things, I think I've learned a lot. And in the early days, I think I have looked at how you have to change your story, because in the first rounds of funding, it's like you've got to get people to believe in this vision of this, something that's on a piece of paper is going to become something. And then as you go through each stage, it's changing that story to be, look, this is now working. How do I take it from here, where it's seeing, a couple of thousand patients a month, to 45,000 patients a month, and this is what I need your money for. So I think there's the storytelling element that I've evolved over time. But I think surrounding yourself with the right people. And the reason why I said about the story last night was, I think what's been interesting to me was I was on a straight path. Medical school, surgical training, become a consultant. And I've definitely not had any problem in feeling, well, actually I've pivoted and done a different route, and actually got to the same outcome of what I would have wanted to do in medicine, is help people. and that's what we're doing. So I think that's also important for fellow founders to not be afraid to kind of pivot.
Yeah.
And also, sometimes change direction as well as you need to. So
yeah,
I think I've learned a lot of learning on the job, but I think a lot of helpful people along the way as well.
And there must have been some moments where you thought, what am I doing?
Yeah.
I'm sure every entrepreneur says that.
I think, there's particularly, I think I'd even say even in some of the funding rounds, I think, we have sometimes I felt like, God, we are going right to the wire. But I've always believed that we've got a good, strong proposition. So I think most founders will say, they've been like, wow, okay, are we actually going to make it through the other side? But it's resilience. I think you've got to be, this is something that I believe in. And there is also the element of you never know. Like I always think that sometimes, I go to sometimes these events and I'm like, oh God, it's another networking event, but you just never know.
Yeah.
And I remember in the early days when I was kind of in this journey of clinician to entrepreneur and raising money, I remember one thing which I did was I went to this event at Bloomberg.
Okay.
And it was a pitching event. There were people just pitching for money. And I thought, well, I need to just understand that. And I sat in the audience. One of my mentors on this, I was part of this NHS clinical entrepreneur program.
Yep.
So he said, you should just come to this. So he got me an invite, and on my badge it said investor. And I was like, well, I'm not an investor. And then I sat next to this guy, and I spoke to him, and he saw my badge. He goes, oh, you look like a young investor. I said, no, I'm just here just trying to learn how these people pitch and what resonates with the audience. And funny enough, the guy I sat next to, he's an investor now in Tympa. He was one of the people he worked at Yahoo and set up their venture fund at Yahoo.
Yep.
It's a hugely successful
Massive,
guy.
Yeah.
But then what was also interesting, that human element, his son was going through medical school.
Right. Okay.
And he said, you know what, do you mind helping him with just the modules and so on? So helped him in my own way. And then from there, he's always been at the end of a phone call. If I said, look, can I have some help and advice? And he's always been there and super supportive through the journey.
Isn't it?
So sometimes you just never know.
Yeah.
And I always say, just, go there and you never know, just spark a conversation with somebody.
Yeah, no. And I think that North Star as well is so important, isn't it?
Oh, yeah, definitely.
You've got to stick to that and be really clear and really intentional on what you're trying to achieve.
And then everyone, when they hear the story, you're not changing the North Star. You might have to pivot, but you're saying this is where we still want to get to.
So so in terms of your style as a leader, how has that developed, and what have you been able to kind of learn from the journey and maybe take from also being a clinical, leader as well?
So I think certainly as being a surgeon, I think there's a lot of transferable skills. Like I think as a doctor in general, and maybe this is generous, but generally you're supposed to be a good communicator. I think as a surgeon, you're trained to be quite decisive. Like you are literally operating on someone and say, right, am I going to make the cut here or cut there? And, get to that end journey with a successful outcome. So I think those have been quite good transferable skills. And I think as a leader, I've always been, I think, or tried to be a bit more, when you're starting a company, like I started as the one individual, there's now 80 odd people in the company. And I've always tried to, anybody who comes in, tell them where we're heading. So be a bit more visionary as a leader. And I think people buy into that. Like you want people in the company who want to know where they're heading. And also, I think in the way the world is at the moment, everyone needs to obviously have a job and that has to pay the bills. Yeah. But I think if people are coming to work, they want to know doing it with some purpose.
Yeah, absolutely.
So I think I've always been trying to be that visionary leader. I think on a day-to-day basis, I think the things which have been, what I've learned is, you go from being the thing which everything flows through. And what I've tried to do is try to not be in every conversation. Yeah. And try to be a bit more helpful at the points where I can be helpful. Yeah. And I think what I've learned is know what I'm really good at doing, bring people around you that can fill those gaps that actually isn't your super strength. And I've probably been, I think the bit which has evolved over time is, as we've tried to scale, in the communication side of it, be a bit more direct and intentional, saying, right, this is what we need to do. Yeah. particularly with the leadership team, so then that cascades down.
Yeah.
So I think I'm more of the visionary. I think very direct, but it's changed over time as the business needs to.
Well, it's 80 people, and it's that balance, isn't it, between the sort of visionary leader and then empowering people to guide. And it sounds like quite hands-on, and obviously when you're very passionate and it's your business, you want to be in the business as well. Yeah. So what are the grand plans? 5 years, 10 years? What would you love to see, in terms of this space and also for Tympa Health?
So I think the grand plans are, I think certainly ear and hearing care is on the agenda now. I think if you look at, there's a couple of things that have happened, I think, in the last few years, which is thinking, well, actually, people are thinking about this. Yeah. So Apple, for example, have, just launched in their AirPods the ability for it to help with hearing loss. Yeah. Software update. So they're like, okay, this is something that's interesting. There's so many people that have ear and hearing issues. Yeah. They launched a bill in the US and now in the UK that you can buy over-the-counter hearing aids. So people are saying it needs to be more accessible. So when I look at the grand plans for Tympa and the space, I think they go kind of hand in hand, because for Tympa, I would be like, this has become more well established in the UK. There's access across the whole of the NHS, plus those sectors that I talked about. Care homes, 50% of those patients have a hearing loss. How do we empower the individuals in the care home to understand about people's ear and hearing issues, particularly with the relation to dementia and falls as well? Then the rest of the world, so the US, Canada, Europe, Australia, I think, the Middle East is booming with healthcare. Yeah. So I think making that impact across those sectors and how we do that, probably with channel partners. And then I think if we're talking 5 years from now, is we should, if we've done all of that, we should be in a position to go to those low-income resource countries, deliver them a service which they never would have had access to. I mean, picture that world where you have someone walks in with this Tympa into whichever country, and they're in a rural environment, and that technology is there, so you could use Wi-Fi to click a button, and someone in the UK or the US is giving them advice to say, do this. That is obviously, if we can achieve that, we've achieved a great thing, yeah.
And obviously when you go about starting up a business like this, you do your competitor analysis and market analysis, and your success obviously to date demonstrates, presumably there is not anything else like this in the market?
Yeah, I mean, interestingly, there isn't any system that brings all of these elements together. The ability to look in the ear at high definition, if there's wax or infection, removing that, doing a hearing check, and then building this technology platform around it that all the data sits in there, and the advice and guidance service as well. I mean, we've got the world's largest bank of ear and hearing images and videos. AI has been built into that now. And we've got about 21 patents that wrap around the whole product. So yes, it's unique. Yeah. Of course, people will have elements of those journey, but the fact that we've made it seamless and accessible, I think does set us apart. And particularly the AI, I mean, it is the stuff we can do and will be doing is going to be really unique. The fact that, you could walk in at year one, everything's normal. Yeah. You'd walk in for your annual check. I mean, an ear and hearing check should be the same as an eye check.
I was going to say, it's not as well known, is it, to go and have your ears checked in the same way?
But let's say you walk in at year 3 and it's predicting, saying, actually, you know what? There's something unusual here. We should be doing something about this now. Yeah. Patients are going to be more empowered to do that. Patients want their own digital record. It's the way the future's going. Yeah. So we want to be able to, in our space, almost give you an ear and hearing passport. Say, here you go. This is what it was like last year. And even if you went to a different clinician, so this is what happened last year, look at what, and then they'll know whether it's changed.
Yeah, absolutely. And I mean, just finally on the kind of the link with dementia, I'd love to just understand a bit more about that. I know there was sort of some triggers and reports that have come out that have talked to that, and there's been a lot of noise around dementia, Alzheimer's.
Absolutely. I mean, I think hearing loss, as I said, the World Health Organization have done a great job of saying it is that single biggest modifier for risk factor for prevention of dementia. And I think, in a very simplistic way, even if you walked around with your fingers in your ear, you feel disengaged with the environment, your cognitive function then adapts to that. And that's where that kind of decline comes from. Interesting. And I think sometimes, I mean, if I take it right to the beginning, actually, of where probably one of the patients which really gave me the idea to solve for it. There was this patient, I was second year doctor, and this patient came into the hospital, was thought that she had an infection. She did have an infection, was treated for that infection, but after that she was still really disengaged with the ward, disengaged with her family, and everyone just said, she's got dementia.
Right.
We need to think about that care plan. And me being a budding ENT surgeon, I thought, well, you know what, let me go and check her hearing. And I'd just come off my ear, nose and throat block. So I looked in her ear, loads of wax. So I said, okay, well, let's remove that. Wheeled her down to the department, removed the wax, and then got her a hearing check. And she had age-related hearing loss.
Right.
Fitted her with a hearing aid, and 6 months later followed up. She was a completely different lady, planning her 80th birthday, engaged with her family. And for me, I was like, well, the only reason that happened was because she came into hospital. And so I think that's the thing of, you know, if you have families or loved ones, you think, well, why not get their hearing checked? And actually, is that what's causing them to be angry at home? Is that why when you have a big family gathering, they're withdrawn?
Yeah.
It's not just memory. Actually, is there something that can be done? And the technology is there now.
Yeah.
So, huge thing. And like, we're really passionate about identifying that early as well.
No, that's amazing. So if you were going to give any advice to anyone maybe in the NHS working as a clinician, identified a potential gap that they really would love to pursue, what would it be?
So I think, you know, we all sit in our clinics and surgeries and probably all, you know, I had so many ideas beforehand thinking, I wish I had this to be able to help me do this problem. But I think it is that bit, I believe that you do have to really live that problem and really understand it in a lot of detail, because sometimes there's a notion of the NHS is hard. Like everyone is fully stretched at the moment, and you sometimes think the grass is greener on the other side. So I think if you are going to make that jump and think about that idea, is maybe do it in phases. Like think, well, we've got this local problem. Let's work locally with some of the people in our own department to see if it makes an impact. So really live the problem before making that jump.
Yeah.
And I think once you've done that, you really have the credibility to then, you know, springboard off the back of that. And I will say, you know, I'm obviously here, we've made a big impact at Tympa. It's not been easy. Like it's been, I think people always think, oh, it must have been, got that idea, raised this amount of money, you know, moved on to the next. I think you have to, it's almost just as hard as doing that medical training, but you do have the resilience in there to if you have an idea you're passionate about. And there's not just examples like me, there's so many of my colleagues who we can see as examples. So I think if they really believe in something, are passionate about it, can talk in real clarity about the problem they're trying to solve for, then I think it's worthwhile taking that jump when they're ready.
Brilliant. Well, thank you so much for sharing your journey. It's been great to talk to you today.
Thank you very much for having me.